Hi, welcome to Functional Friday. I'm Dr. Sherry Jacobs, naturopathic doctor, certified nutrition specialist. I'm a Shannon Kennedy, internal medicine doctor. And today we were going to talk about a very popular topic, or something that gets people in the door rather quickly, mostly females, and that is hair loss. How many times have you heard patients come in or complain about hair loss?
We hear it every day.
Yes.
Every day.
I always say nothing gets somebody in the door more quickly than hair loss, and I think partly because certainly there's an aesthetic component, but I think we just intuitively know that something's off when we're losing too much hair, or if we have a skin issue, something's flaring up. We just know internally there's something that's not quite right, and it's rather disconcerting.
Yes.
So what's one of the first things we might do to work up somebody with hair loss? Maybe some labs that we might run?
Sure. We usually start seeing hair loss in women in perimenopausal age, and so one of the first things we think about is hormones. We definitely look at their hormones, but also by that time in life, nutrition, has usually taken a turn for worse if they're not really paying close attention to what they've been eating and supplementing with. And then we talk to them about their stress, because stress certainly plays a big role in it, and family history, patterns of hair loss in the family, autoimmune diseases, and then any other systemic symptoms like rashes on the skin, or just physical things that they've noted over time.
Yeah, and I think some of this deep workup comes when there's actually patches of hair loss. Thinking about autoimmune and so forth. I think a lot of people though just notice this diffuse loss and clumps in the shower, just as they're pulling out their hair or they're brushing their hair in the morning, they're just seeing tons and tons more turnover of their hair follicles.
Right. The timeline too, when people have a big stressful event in their life, whether it's delivering a baby or having a surgery or loss of a loved one, or even just moving, which is very stressful, we notice there's a delayed response in hair loss. It usually occurs like 6 months later.
Right.
They'll have this big stressful event, they'll get through it, life is getting back to normal, and then their hair starts thinning. And that's a temporary thing, but we still do the workup. We want to make sure we're not missing anything, because hair loss is a sign of underlying imbalances, so we will still do the workup, which would include a panel of blood tests looking at nutrition, hormones,
Thyroid,
and autoimmune markers.
Yep. And then I think something you'll hear from us all the time is that when we say thyroid, we mean a full thyroid workup. We don't just mean a quick TSH. We really kind of look at the thyroid as a whole and figure out all the different components. And then looking at sometimes a key factor with hair loss would be iron, and your ability to absorb iron, how much iron you're getting in the diet. And there's a marker that I don't think is as readily measured, which is your storage form of iron, called ferritin. And that can be a huge indicator that something's off, and that if that's too low, all kinds of things happen, including hair loss. And I personally, not that I like somebody to have low ferritin, but sometimes it's like, oh, there it is, it's right there, instead of having to go down the huge rabbit hole sometimes that we definitely have to go down sometimes with patients.
Right. And then that leads us to, a nutritional replacement of iron, but also looking at why is this person not absorbing iron from their foods if they have an iron-rich diet. But also from a conventional medicine standpoint, then we've got to work up, well, why are they losing so much blood? Are their periods too heavy if they're menstruating female? Or are they losing blood through the GI tract, either through, a colon polyp or colon cancer, or an upper GI source of blood loss like an ulcer? So we start looking at more concerning things. They come in with hair loss, and we might diagnose an underlying disorder. So it's really important to have that looked at, because it is a sign that something is wrong.
Yes. So, and I always think about, I can't remember which patient of ours it was, but she said the other thing that was stressful to her about hair loss was that was her connection to a higher being, or her God connection. And I always thought that was a really interesting way to say, like, why it's so disconcerting for us as women is that is a connection to something else, something bigger than us. So.
Yes, I would like to say that it's normal to lose up to 200 strands of hair a day. And so there's some amount of hair loss that we sometimes get panicky over. When you have short hair and you're walking around throughout the day, your hair sheds and it falls out to the floor. And as your hair gets longer, especially if you keep it tied back in a ponytail, all those hairs stay in there. So at the end of the day, when you take your ponytail out, you comb through your hair, you get in the shower, you might see up to 200 strands of hair, which is a lot, to see all at once, but that's not necessarily abnormal. So the pattern of hair thinning, how many strands are falling out a day, all of that's really important.
I think we could do a whole day lecture on hair loss.
Yes, yes,
Okay, happy Friday.
yes.